Hi, we're Team E2, and our solution we came up with was hybrid communities to combat social isolation. So, our aim was to balance public health and safety of nursing home residents and staff with the negative impact of social isolation on resident physical health, mental health, and quality of life during this pandemic.
Loneliness is a pervasive problem that has been exacerbated by the COVID-19 pandemic. Especially hard hit are the elderly, who are often isolated from their friends and family. The prevalence of severe loneliness among the elderly who live in care homes is more than double of those who live in the community. A survey of 365 nursing home residents in 36 states from July to August of this year asked residents how often they engaged in various common social and other activities before and after the COVID-19 restrictions. It found that a significant portion of the residents felt lonelier under the restrictions, which isn't surprising given that most indicated that they no longer even leave their rooms to socialize with other residents, participate in any in-home activities, or even eat their meals in the dining room. Consequences of loneliness include increased risk of depression, alcoholism, suicidal thoughts, aggressive behaviors, anxiety, and impulsivity. Moreover, loneliness is also a risk factor for cognitive decline, progression of Alzheimer's disease, recurrent stroke, obesity, elevated blood pressure, and mortality. Some nursing homes have tried to use methods such as video calls, social media, and window visits. However, these cannot replace the benefits that come with in-person communication, especially touch. Carrie Johnson, a resident of a nursing home in North Carolina, hasn't been able to see her husband in another wing of the home since March. He is in a golden prison, and so am I, she says. I know he isn't going to live forever, neither am I, but I don't want to lose him this way. Every day that the crisis persists, those in long-term care facilities are forced to confront the risks of living in close quarters with other vulnerable residents and weigh that with the possibility of dying alone.
One of the desired outcomes of this social pod system is to increase residents' quality of life through increased socialization, and this will be measured by the Older People's Quality of Life Scale. Since depression is a common consequence of prolonged isolation, we hope to also decrease rates of depression by increasing socialization. This will be measured by the PHQ-9 depression scale. From a pharmacy standpoint, we can think ahead and hope that by improving residents' depressive symptoms, we can potentially deprescribe antidepressant medications in the future. Our last desired outcome is to maintain low COVID infection rates despite increased socialization.
As mentioned before, we will be implementing an opt-in hybrid community system within our nursing facility. This idea was based off of some of the education models that have been implemented for students returning to the classroom. The details of our plan are outlined below, but some highlights include that this will be a 4-week rotation for 4 trial pods on the 5th floor of the building, given that these pods have no positive COVID patients at this time. Residents will spend the 4 weeks doing 2 weeks of social interaction, including 1 week only within their pod on their floor and 1 week in public spaces such as the dining room or sunroom, and then 2 weeks of standard isolation so that any new symptoms can be caught and mitigated before being spread to other residents. Before joining a pod, it is crucial that we have 2 negative COVID tests so that we can ensure safety within our pods moving forward.
This plan will be implemented using 2 main strategies. The first being increasing safety measures to allow for safe in-person socialization, including restrictions on visitors, additional cleaning, and preventing staff crossover between pods. The second strategy will be increasing technological support for residents during their periods of now standard social isolation so that they can still have meaningful connection.
There are several strengths of using this system, including in-person interaction with other residents and staff should be better for communication than using tablets or other electronic devices alone. Increased interaction with co-residents can offer companionship throughout the entire day. And before the COVID-19 pandemic, Dodie Smith, a resident, used to go up and down her hall visiting with staff and other residents and would go to the cafe for milkshakes and gossip. She would be able to resume activities such as these using the pod system once she tests negative for COVID-19. And finally, if a resident within a pod were to test positive for COVID-19, a potential outbreak would be contained to one pod and likely would not spread to other parts of the nursing home.
With hybrid communities comes some challenges as well. Increasing resident interaction increases the potential for disease spread. Furthermore, staff may also be concerned with their personal safety, given the staff to pod ratio and their need to separate amongst staff. Furthermore, greater surveillance and speedy recovery, speedy response will be required in case of a COVID infection per pod. Residents will also still be isolated 50% of the time, risking continued loneliness. And finally, family or a power of attorney opt-in will be needed for those residents with cognitive disabilities.
As noted before, we will evaluate those within each pod using the Patient Health Questionnaire 9 and the Older Adults Quality of Life Scale before we implement our plan and every 4 weeks after. If there is no improvement in scores, then we will survey residents on their perceptions on the program. There will also be weekly coronavirus tests for all residents, and if there happens to be an increase in cases, we will discontinue the program until all residents and staff test negative 2 times.
Without a reasonable method to incorporate socialization into the lives of nursing home and long-term care residents, they could face the deleterious consequences of profound and prolonged loneliness, which could result in depression, health declines, or even death. This is often lost when discussing the elderly due to the ageism that affects decision-making. Although ageism is built upon the view that all elderly people are frail and unable to socialize in the midst of the pandemic. However, this needs to be weighed against the benefits of allowing socialization in a controlled setting. Looking to the future, we hope that the significance of the hybrid communities would be the introduction of autonomy, freedom, and overall benefits of the lives of the residents of these nursing home residents.